Hello and welcome to your student health plan with Western Kentucky University, brought to you by Academic Health Plans. Academic Health Plans is your plan administrator, and we provide the following services: a custom website specific for WKU students, where you will find plan materials such as flyers, brochures, master policies. You'll also be able to find information about enrollment and waivers. We also provide billing, customer care for enrollment, and on-campus support. United Healthcare Student Resources, or UHC, is your insurance carrier. UHC provides claims administration and customer service, distribution of ID cards, and access to a large network of providers. WKU.myahpcare.com is that custom website specifically for Western Kentucky University students. On the benefits page, you'll be able to find plan details such as your plan highlight flyer, brochure, or master policy. You can also see how your plan works, get information on your value-added benefits, as well as academic emergency services. The enrollment page is where domestic students will enroll. You can also check dependent enrollment deadlines, as well as get information on enrolling in qualifying events. Understanding your benefits. This is a chart taken directly from your plan highlight flyer. So let's talk about some of the vocabulary here. Individual out-of-pocket maximum is the amount you will be responsible for before the insurance company begins to pay your claims at 100%. So your individual out-of-pocket maximum for preferred providers is $6,850. Your deductible is the amount you will pay out of pocket before the insurance company begins to pay. Typically, this does not apply to doctor's visits and prescription drugs, but you can see again from this chart, if you go to a preferred provider, your deductible will be $500. But your copayment is the amount you will have to pay when services are received. So in the example that we have pointed out here for medical emergency services, if you go to a preferred provider, your copayment is $250 per visit. So each time you go to have medical emergency services, you will pay $250. However, you do see it says 80% after a $250 copayment per visit. So after you pay that $250, the insurance company will pay 80% after that. Your coinsurance is the percentage the insurance company will pay for after you meet your deductible, but before your out-of-pocket maximum is met. So in this example, for hospital room and board expense under out-of-network provider, the insurance company is going to pay 60% after you have met your plan deductible. However, if you'll notice in the preferred provider column, they will pay 80% after you meet your deductible. So it's safe to say going to a preferred or in-network provider is going to save you money. Understanding your enrollments. Open enrollment are dates during which you can enroll dependents in the plan. The coverage period are the dates that your health insurance will pay your claims for the current plan year. So in these examples, we see that summer open enrollment begins April 16th through June 17th, but coverage doesn't start until May 4th and ends July 31st. The premium is the amount that you will pay per semester for your coverage. So for summer, your premium will be $542. Academic Emergency Services provides immediate access to assistance if you experience a travel-related crisis. Some of the services that AES includes are emergency medical evacuation. If you're overseas and an emergency occurs, we're going to get you out of there ASAP. Medically advisable repatriation. So if you're studying in the United States, we're going to make sure that you get back home if your health depends on it. Visit by family or friends is when there's a medical emergency and you're hospitalized. We will make sure that the ones you care about most are there to support you. AES also provides pre-travel information, assistance with lost luggage, prescriptions, and translations, and emergency message transmittal. For more details on AES, you can of course visit that custom website, wku.myahpcare.com, and click on the Benefits tab. COVID-19 resources. Testing and treatment for COVID-19, there are no copays, deductibles, or coinsurance for medically necessary lab tests to diagnose COVID-19. Your doctor does not have to ask the insurance company for permission to test you for COVID-19. In regards to treatment, there are no copays, deductibles, or coinsurance related to treatment for COVID-19 at an in-network facility and treatment for out-of-network emergencies. Healthiest You Telemedicine is where you can talk to a board-certified physician 24/7, 365. There's no appointments necessary. You can avoid trips to the doctor's office, urgent care, and emergency room with Healthiest You. Keep in mind, there is a $40 consultation fee for non-UHC members, but this service, Healthiest You, is free for UHC members. You can also use whatever device is convenient for you, your smartphone, tablet, computer, or laptop. Optional supplemental coverage. You have two different plans, one for vision and one for dental, that you can have as an add-on service to your medical plan. One of them is VSP Vision, and vision coverage is an add-on service. So medical insurance plans, they cover illnesses or diseases of the eye, but they don't cover routine examinations, glasses, or contact lenses. Dental coverage is also an add-on service. And again, most medical plans will cover accidental injuries to natural teeth, but not routine exams, fillings, or braces. Note that vision and dental for insureds under the age of 19 is often covered in the medical plans. But these are your two options if you wanted to have these add-on services in addition to your medical plan. Top health plan tips. First, use the free nurse line to find the best plan of action for medical treatment. If you need information on your plan or need to access important healthcare information, wku.myahpcare.com should be your first stop. That custom website is going to have everything you need there. You can use the web tools to find a provider. Remember, always choose an in-network physician because it will save you money. Check online reviews before you choose a physician. Use the emergency room for emergency situations only. Create an account by clicking on Create a UHC Account Flyer. That's where you're going to obtain your ID cards and see available discount programs and much more on that wku.myahpcare.com website. Remember to always carry your ID card with you. Keep receipts of all payments made for medical services and prescriptions. Request your provider to prescribe generic drugs to save money. And keep us and your school informed of any address changes. Last but not least, if you have any questions in regards to enrollment information, please do not hesitate to contact us here at Academic Health Plans. You can find information on how to contact us on wku.myahpcare.com, or you can go directly to help.ahpcare.com, where we have customer service agents ready and willing to help you with anything that you need. If you have questions in regards to claims and benefit information, you can contact United Healthcare Student Resources at 1-800-767-0700. Thank you for watching this video. We hope that it has been informative and that you have learned more about your plan and your benefits. Again, if you need anything, please reach out to us, and we wish you well in this upcoming semester. Okay, I'm just going to be done.